We're taking a number of steps to address the disparities that we are seeing when it comes to COVID-19. I'm going to share some of them and acknowledge that there is much more that we need to do and are planning to do. We are engaging community stakeholders in helping to identify and implement targeted messaging strategies to our higher risk populations, as the governor highlighted yesterday. I've also referenced in the past our health equity zones. These are our community-led partners who have been our eyes and ears on the front lines to help us understand the impact of the COVID-19 response and the policies at the neighborhood and community level. How is this playing out in the various communities throughout Rhode Island? We are also adjusting our contact tracing approach to make sure that our language capacities meet the needs of Rhode Islanders so that everyone has access to the testing capabilities as well as the guidance for contact tracing, isolation, and quarantining. Another approach we're taking is to strategically align our testing resources with trusted and existing systems that are embedded in communities. Healthcare systems, community-based organizations, our health equity zones, partners, and many more, so that we can best address those who are most significantly impacted. And finally, we are joining with our Commission for Health Advocacy and Equity to address the disparate impacts of COVID-19. This Commission for Health Advocacy and Equity was legislatively established with the mission to help the state monitor and respond to health disparities and promote health equity. The Commission's recently released legislative report and statewide health equity measures are helpful for us in times just like this, so that we can understand what impacts our health and who and where our most vulnerable Rhode Islanders are. These statewide health equity measures are available online at health.ri.gov/data/health equity. The Commission has been leaders with its members as they have connected to the community so that we can and will be able to provide the resources needed so that we can address and shape our response to work to reopen the state and rebuild the economy in a way that is inclusive of all communities. I know the governor's committed to this, Secretary Pryor is committed to this, and we join with the Commission for Health Advocacy and Equity that's going to support us with this as well.